we are going to interview a diabetic who would like to remain anonymous, so his face will be blackened. He has questions for us today about what diets are beneficial for him while he has diabetes. Come on, let's go.
Hi, my name is Marty. I am a diabetic. I was diagnosed type 1 diabetic when I was 2 years old. I have to inject insulin on a regular basis, mainly after meals and everything. I find that a lot of diets out there can help control my diabetes, but none of them really kind of get away with it, because I guess type 1 I'm going to have the rest of my life. I would like to know about some vegetarian possibilities I could go on to help control my diabetes and what insights this group might have. Please pray for me.
Being on a vegetarian diet has many benefits, which includes promoting a healthy body weight, improves blood sugar control, and insulin response. This may mean taking less medications and lowering your risk of diabetes-related complications. For those who already have type 1 diabetes, a vegetarian diet can help reduce the complications of the disease. Vegetarians have been found to have lower rates of type 2 diabetes and exhibit significantly less insulin resistance than non-vegetarians. This may be because meat consumption has been associated with increased risk of diabetes. Vegan diets have been shown to benefit the specific insulin-producing cells. The vegetarian diet can not only help prevent diabetes, but also help reverse the disease. Almost half the diabetics placed on a vegetarian diet were able to stop or reduce the doses of insulin in only 6 months, and a majority of patients experienced a rapid remission in nerve pain, which is a common complication of diabetes. All these benefits of a vegan diet are possible even without exercise.
When comparing a healthy normal diet and a vegetarian diet, both diets require a large variety of foods in order to obtain the optimal amount of vitamins and nutrients. Today we're going to give you descriptions of a regular diet, a lacto-ovo diet, and a strict vegan diet. We're also going to give you examples of meals that you can eat to meet the criteria of these diets. We also will tell you about some of the nutrients that can commonly be deficient in these diets. I'm on the regular diet, so I consume all foods within moderation and getting all nutrients and minerals. So I'm consuming for my lunch today a whole wheat sandwich with turkey, tomato, cheese, and onion, a side of Doritos, and 2% milk. My sandwich still includes a decent amount of vegetables, although it does still include meat from the turkey and dairy from the cheese. My Doritos are a package of 250 calories. It'll have 13 grams of fat and 30 grams of carbs. This is going to be using up a large amount of my daily fat amount, and I could also find a smarter way to expend my carb amount. For my 2% milk, it's going to be 120 calories in one 8-ounce cup, 4 grams of fat, and it does contain cholesterol, whereas something like soy milk wouldn't. It also doesn't contain much fiber, where soy milk does. The protein that I'm going to be getting from this milk will be beneficial in comparison to soy milk because it doesn't have much protein.
I am a lacto-ovo vegetarian. My diet includes milk and milk products and eggs, but it excludes meat, fish, shellfish, and poultry. One of my lunches can consist of a grilled cheese on wheat, a boiled egg, a mandarin orange salad, and also some milk to drink. One concern with vegetarian diets is where do you get your protein, but I can still get my protein from whole grains, legumes, seeds, nuts, and vegetables.
Hi, I'm a vegan. I'm considered one of the pure vegetarians of the group. The reason I choose this lifestyle is because of my stance against animal cruelty, or it could be due to the fact that I might have a health condition that would cause me to change my lifestyle and health problems. Or also, I'm just trying to lose weight for the beach season. The vegan diet is very appealing, especially to diabetics, due to this low saturated fat content and also its high fiber content. This helps with the insulin problems we face and everything like that, to where it might not secrete as much glucose in our blood and everything like that, to where we're going to produce insulin, keeping us under check. Some foods vegans typically eat are like your soybeans, your edamame, vegetable pizzas, vegetable burgers. There's tofu, soy products, everything like that. I have some edamame here, some pasta primavera, a couple other things. Also, soy protein is very important in our diet. It's actually the main source of protein for us. We do get a lot of other nutrients from this diet, but there are some nutrients that we do lack in this diet now. The main deficiency we actually have is vitamin B12, which causes us not to have a lot of energy and also not to metabolize our carbohydrates properly. Thank you.
A vegetarian diet has many benefits with those living with diabetes. One important thing to monitor with vegetarian diets, or any diets, is total caloric intake. Because many vegetarian diets do not eat or limit the amount of dairy, it is possible for the total caloric intake to drop. Fats are the most caloric dense food with 9 calories per gram. A great way to stay healthy is to consume the correct number of calories to meet your daily needs. The My Period, My Plate offers an interactive program which allows you to find the average energy use with regards to height, weight, sex, and activity level. In Hillary's regular diet, it states that she should consume 2,100 calories per day. In this personal plate, it contains 770 calories. If her 2 other meals were comparable to this, she would be right on track for meeting her daily needs. Jordan's average of caloric use should be 2,700 calories a day. His vegan plate contains 460 calories. If his other 2 meals were comparable to this, he would be 1,300 calories short. Tracie's average caloric intake should be about 2,000 calories a day. Her lacto-ovo meal contains 513 calories. If her 2 other meals were comparable to this, she would be 500 calories short. It is important to reach your daily caloric needs, especially with vegans and other forms of vegetarianism. It is clear to see that most vegetarians' meals will contain less calories per serving. A great way to combat this is to eat more meals per day and include snacks in between them. Smaller meals will help keep blood glucose more normal and give plenty of energy to meet the demands of each day.
Vegetarian diets have a bad reputation about not getting the recommended daily nutrients. They actually can meet these recommendations by consuming a variety of foods and the right amount of foods that meets their calorie needs. To make sure they are getting the adequate nutrients, they should follow the food group recommendations for their age, sex, and activity level to make sure they are getting the right amount of food. There are still nutrients that vegetarians should focus on while on their diet. These nutrients are proteins, vitamin B12, iron, calcium, and vitamin D. It usually is thought that vegetarians do not take in enough protein. It is actually fairly easy for vegetarians to get their recommendation of protein. They have to eat a variety of foods such as nuts, tofu, whole grains, and for lacto or an ovo or a lacto-ovo vegetarian, they can also consume dairy products and eggs to get their protein. A big vitamin that vegetarians lack is B12. B12 is found in animal products or fortified foods. A supplement should be taken are the foods such as fortified cereals, grains, and fortified soy beverages should be taken if B12 is not in their diet. If B12 is not in their diet, a B12 deficiency can occur. Vegetarians have a greater risk of iron deficiency compared to a non-vegetarian. The richest source of iron can be obtained by animal products, but iron requirements can be reached by intaking spinach, dried beans, enriched products, and dried nuts, or dried fruits, my bad. Calcium deficiency is more common in vegans than any other vegetarian. They should focus on eating leafy green veggies, broccoli, and fortified orange juice. Vegetarians who eat dairy, like our lacto-ovo vegetarian, should be able to reach adequate amounts of vitamin D. In the absence of sun, vitamin D supplements should be taken. If lack of adequate nutrients are not taken in, it is important to use supplementation to include vitamins and nutrients you are lacking so you can avoid deficiencies. For those who are on the vegetarian diet, experience deficiencies, but are also considerably more healthy than people who are on regular diets. People who are on regular diets can benefit from these vegetarian diets, but learn a lesson and learn that they can still have a very decent meal and it's very self-satisfying. So, yeah.
So what have we learned today? Technically, a vegetarian diet is the optimal diet to be on when combating diabetes. But realistically, there are many diabetics out there who do not prefer a vegetarian diet. But if they are maintaining a good diet and following the steps necessary to controlling the risk of complications the disease might cause, the symptoms are lower.